Almost there. Hang on.
Yep.
Okay. Yeah, I know. And we are recording.
Okay. Good afternoon, everyone. Welcome to the Southborough Board of Health meeting on Tuesday, January 4th, 2022 at 12 p.m. It is 12:01. All members are present. So first, I will go to public comment. If anybody has anything they want to share before we start. Okay. So the meeting minutes from 12:21 and 12:28. Barbara was kind enough to get those done for us already. I did edit them, although I made an error as related to the meeting right now. It should be 12 o'clock for today and not 10:30. And I clearly was very convinced it should have been at 10:30. So I apologize for that. So Barbara, I just have that one amendment. Safdar and Nancy, do you have any changes to those two sets?
I do not. I thought they looked great.
I do not either.
Great. Okay, so I move that we accept the meeting minutes from 12:21 and 12:28 as amended.
I second the motion and vote aye.
And I vote aye.
And Malinowski is aye.
Okay.
And so that passes unanimously. Thank you. I sent around the executive session minutes for 12:28. Does anybody have anything that they'll want to discuss on those?
No, I thought you did a good job, making it concise, and it looked great.
Okay.
Yep,
Okay.
I agree. I agree. Very easy to follow and had all the points that we needed to know. Thank you.
Okay. So those we're just approving, not releasing. So
Okay.
I'll make a motion that we approve the 12:28 minutes. Executive session.
I second the motion.
Exactly. And I vote aye.
Okay, I second the motion and vote aye.
And Malinowski's aye. Thank you. So I had asked the town clerk and the town moderator to join us today to talk about town meeting logistics and any safety protocols that we want to recommend. So if everybody's okay, I'm just gonna skip down to number 6 on the agenda because they're both present. Is everyone okay with that?
Yes.
Yes.
Okay. And I'm gonna go ahead and pull them over along with Heather.
I made it worse.
Heather.
Uh-oh.
Hi, Paul and Jim. Thanks for coming.
Hi.
We lost Paul.
You haven't lost me. I'm dealing with a few device issues here.
Okay.
So
There
there
you
I
are.
am.
Great. Thank you both for coming.
Thank you.
And I put this on the agenda because the selectmen are closing the warrant this evening and wanted to get ahead of any logistical recommendations from the Board of Health, given what's going on currently and potentially in the near future leading up to town meeting in March. So I thought it would be beneficial if we could have this discussion this afternoon along with the moderator and the clerk. And then I also posted a joint meeting for the selectmen's meeting tonight at 6:30 for Nancy and Safdar, so that if you are available to join, we can also have a joint discussion on any recommendations that come out of this discussion. So I guess Safdar and Nancy, any initial kind of reactions to, or initial recommendations that we would foresee at this point? So I'll open it up to either of you to start.
Well, I don't think we can lift any of the safety measures we took in the fall, certainly with the way things are spreading. I don't know. Safdar, what do you think?
I agree 100%. If not, if anything, we need to be really, really fine tuning it to make sure we've covered everything, given the fact that our cases are skyrocketing. And again, we don't know what the first week of March or second week of March is going to look like, but we need to sort of plan for, to make sure everything is safe. So I think, again, masking, a properly fitted mask is essential by every single attendee.
Mhm.
The chairs have to be 6 feet apart. Households can sit together. And I guess really the issue, Jim, is going to be space issues, because we're going to expect more attendance, I'm assuming, at this meeting than the special town meeting, and how those are going to be resolved. But I think we need to keep that at a minimum. I don't think we can change any of that right now.
I don't either.
So if we had the option of doing an outdoor meeting versus an indoor meeting, would it be fair to say that we would prefer an outdoor meeting if possible?
If possible, I mean, I guess, Jim, can you plan for both? Is that too much? Should we just, with the unpredictability of the weather, do you plan for both, or do you just plan for indoors because it's too much planning if you have to do both?
It's straightforward. But I do want to jump back to your comment you made about capacity, though. We survived the special town meeting by the skin of our teeth, honestly. Literally another half a dozen people, and we would not have been able to fit anybody in. That's how tight it was. So we planned for 260 seats before we had families pushed together. And by the time you add in guests and so forth, we had an attendance of slightly under 300 people. We can't fit more than that using the two rooms at Trotter, the gym and the auditorium. Even if we were to incur the extra expense of going to classrooms, by the time you separate everybody 6 feet apart, it just goes downhill. So whatever draws people to town meeting, in our town, attendance tends to be issue driven. And it's, it's hard to see at this point what will be the hot topic issues. So it's easy for us to plan for this, an indoor, and then switch to the outdoor. We've had experience doing that. There is another option that may become available. A bylaw that was passed in the special town meeting gave the selectmen the right to hold a meeting in an adjoining town. Now, that hasn't been approved by the Attorney General yet. We expect the review of the votes of the special town meeting to be done in early to mid-February. That's the par for the course. If they were to approve that, and I have every reason to expect that they will, that would give an option to hold this at Algonquin in their either outdoors or in. So if that were to be approved, and if that was a decision of the selectmen to move that to Algonquin, using their gym and their auditorium, we could increase our safe capacity to somewhere between 425 and 500 in that range. So we'll just have to see, but we'll be prepared to do whatever they choose to do. We can do it safely.
Wonderful. I thought you did a great job in the fall.
Oh, I got to tell you, I've worked as a busboy, but never as a maitre d', and that's what I was doing, running around with chairs, just trying to seat, party for two over to here and everything. It was wild.
It was great. No, I was there, and as a non-resident, I decided to just stay in the hallway because I could tell the shuffle for seats was going on.
Oh yeah, a lot of lessons learned from that, and we'll always try to improve upon the process. But it was a wild night. It was wild.
So can I raise my hand?
Go ahead.
Whatever it takes to get into this conversation. I don't, so I understand and agree with everything that's been said, except I don't anticipate supporting going outside.
Yeah.
26th or March 16th or whatever it is. So, theoretically we can do it. We could set it up. We could put the chairs out there and all that. But I think we're swimming upstream at that point to get people to come. So I do, sort of in order support going, planning to go to Algonquin. Jim, I don't know if we need the school committee to approve that or some other permission from superintendent's office. But if we were in the double gym at Algonquin, we'd have plenty of space. We'd be inside. It would be, the parking lot is right there. I mean, it makes too much sense not to do it that way, it seems to me. So I just wanted to throw that out there.
Well,
I agree.
if
I
you were to
agree.
go to if you were to go to Algonquin, you'd still want to use the auditorium because the the auditorium, because the gymnasium is probably only going to give you somewhere around 260, and it would be cutting it
Okay.
close. But
Well,
I'm with you. If you're going to go outside, we should realistically wait until the weather's warmer.
Right, right. And you know, Algonquin may have some unforeseen factors like, do we need to use Northborough Police instead of Southborough Police, for our security and so forth. Those are all things I know can be worked out. But I think we ought to start planning for that now. And Jim, I hear you on overflowing into the auditorium there, and that's fine with me too. I just think being inside and using the double gym will give people plenty of comfort that it's okay to come. Not literal comfort, but also obviously mental comfort.
Right. I've already reached out to the superintendent about going over there to get exact capacities and such. So we'll have to see what's down the road. And of course, the other piece of this, who knows what their sports schedules will be like for the spring and the rest of it. But, again,
How much I don't know this. Sorry, Jim.
Sure.
I know you know this. Where does Northborough do their town meetings?
Generally, it's in the auditorium.
Okay.
But last year when they held an outdoor one, they actually held it on the football field.
Yeah. Okay.
Yeah. But the schools have been superb to work with. I can't say enough good things about the administration and the folks at Trotter. Are wonderful to work with.
Well, yeah, different administration, obviously at Algonquin, but just as cooperative. So they don't have any experience in leveraging the gym that we can learn from, which is okay because Jim, you've never had any problem, figuring it out, ad hoc. So again, my preference would be to target the Algonquin gym.
And just to clarify, I wasn't suggesting that we plan for an outdoor town meeting in March. So if we move out town meeting date, is that what the preference would be, is to do it outside if that's doable?
Yeah, I think Jim's prepared to. If we ended up outside later in the year, I know he's prepared to do that because we've done that successfully twice now.
And just one last thing, regardless of whether we hold it outdoors at Southborough or in the gym in the auditorium at Southborough, the incremental cost is roughly the same to do both. And I've talked to Northborough about their cost to hold it outdoors, and I think the cost to hold it in Northborough would be roughly the same. I don't see any significant issues up or down on that.
Okay. Great. Does anybody, I know we just went through this a couple months ago, but I felt like it was important to just make sure we were ahead of any planning phases that Jim or Paul or anyone else needs to do. So
yeah, I think
Taylor.
With cases, we can't predict what's going to happen in March, right? Like, I think that would be our huge factor. It's like, if they're still going crazy, then we would really should think about moving it. But we've seen the peak pass in other places for Omicron already, but the peak back down has been really slow. So I think it would just depend on what's going on with cases in the town.
Mhm.
Chelsea,
Prepare
just
for the worst.
to pick up on that point, moving the meeting under the governor's emergency authorization from now almost 2 years ago, that's still in effect. Jim, right? Still in effect, right? It's a convoluted process where it can only get 30 days at a time, but you can keep moving it until you need to, till as many times as you need to. The way that the emergency authorization is written is I have to move it. Obviously, collaborate with the Board of Selectmen on that. So just keep that in mind as it gets closer.
So we have a document in our packet for tonight for the selectmen's meeting that gives town council's opinion on the selectmen being able to move it. Even though it's listed in the town bylaw as a certain date for any given reason. So I think there is a way for the selectmen to move it without needing the governor's order.
I'll be interested to hear about that.
Okay, so that will be.
I'm
part
not
of-
disagreeing with you. I hadn't heard that, but I'll look forward to it.
Okay, so we have that on in our packet, and we'll bring that into the discussion tonight. I just wanted to make sure that we at least could give a recommendation from the Board of Health perspective on, you know, essentially keeping the requirements the same as what we had.
Yeah.
Okay. Anything else on this topic?
No.
All right, thank you, Paul. Thank you, Jim. We'll see you.
Cheerio.
Cheerio.
Bye. Thanks, Barbara. Okay. Okay, town mask advisory. So given the number of cases that are skyrocketing in the community, I was asked to bring this forward for discussion for a town mask advisory. And so Safdar, do you want to kind of take the lead on this one?
So I think, inconsistent with what Northborough has done as well. I mean, the state has a mask advisory in place already, but I think it's a very powerful statement coming from us locally, from our Board of Health, to issue a town mask advisory for any indoor space in town, public places, and other locales as well that are indoors. So, and I think as the case numbers they speak for themselves at this point.
Yeah, and I think we can put out the language that the state issued on our website as well. It looks like Northborough did that, just to show that we're consistent with what the state is doing. I was also thinking it may make sense for us to reach out to the EDC and see if they can send our advisory out to the businesses in town so that they're aware of it, and just to make sure that people understand that things are definitely, I mean, they're skyrocketing everywhere, but that it's also here. Nancy, any thoughts?
No, I think it's a good idea. I mean, quite honestly, you go from town to town doing your errands and it's like, oh, do I need my mask? Do I not? So it seems like a lot of more people are wearing them just because you're not sure on the town you're in at the time if you have to or not. So, and with the skyrocketing, I've seen mostly everybody when I go shopping wearing them. So, I mean, I don't think we'll get a lot of pushback from it.
Right.
Do we
I agree
want
with
to
you.
encourage that businesses also put a sign up? Because not all businesses have that. So maybe in your communication, Chelsea, also have the EDC put out a statement saying, we are, I know we can't mandate, but strongly encouraging that a sign be placed outside. And ultimately, I think it'll help their business, because a lot of people do not want to go into a business where a large number of patrons might be unmasked. So
True.
I think that's a great idea.
Yeah, and I've been keeping in touch with the other towns, and the mask advisory we can put in place today, but we still would hold out that we might revisit a mask mandate in the next few days or week. I think Grafton and Westboro now did a mask mandate. Northborough is going to revisit it this Thursday. They have the advisory, but they may revisit a mandate. But
And Poppington
the
also has a
mandates,
mask
right?
mandate.
Go ahead.
Oh, I just said Poppington also has one that they adopted this week.
Okay. Okay. So we do not have a meeting scheduled until the 18th.
Right.
So do we want to pencil something in case we want to do that? And add an agenda? So the earliest so it's Tuesday, the earliest we could do it would be like Thursday later, or Friday morning.
So
don't know
the
what it is.
13th or 14th, or you're talking this week?
This
The
week
6th.
or the beginning of next week.
So I'm working Friday, but I'm available on Thursday. And then I'm available on Monday.
What time could you do on Monday, Nancy?
I'm wide open on Monday.
Okay. Safdar?
I can do Monday morning.
Okay. So let's pencil in Monday morning. And then we'll know what Northborough did by then too.
What time are we thinking?
9:30. Does that work?
Does that work, Seth?
That works for me.
Okay.
Yep, that's fine.
Heather and Taylor.
Yep, that's good.
Okay. All right. And I'll just make that the only agenda item unless we have something other else come up. Okay. So,
Right, we'll see how it goes the next day, right? I don't know if we'll quite know Northborough yet, but I'll get a better sense of what they're thinking.
thanks, Heather. Okay. So do we want to take a motion that we do a town mask advisory? Okay. So I move that Southborough Board of Health adopt a town mask advisory effective immediately.
I second the motion and vote aye, Saka.
And I vote aye, Medina.
And I, Malinowski. Okay, thank you. Okay, next is we're looking to extend temporary per diem clerk contracts for the COVID vaccine clinics. And I
Yes.
should have put 4:30 and not 3:31. So I'm going to change that to be 4:30 of 22.
Okay, with our changing landscape, we don't exactly know when these clinics are current, but I've confirmed with 3 clerks to extend their temporary per diem contract as it stands till April 30th. Marge Achilles, Dina Zeibel, and Ingrid Mans.
Okay.
Okay,
Great, thank you. And Heather, you and I discussed kind of making sure that we have funding for these clerks because they're not in our budget. So FEMA is covering them for now.
for vaccine clinics for now, right? And I think we'll just have to take that as it comes, and also it's later on the agenda, Metro West, we can
Yes.
apply.
Okay,
But I think, I don't know if we'll need them for that many clinics between now and April. The landscape is so hard to say, but
I
I
know.
actually don't think we will. Northborough seems to have admin staff and volunteers. So it would truly probably be just the ones held right here in Southborough. So I don't think,
Yeah.
we'll see.
okay. So it's just really if we need it, then it's available and we'll figure out the funding on the fly, unfortunately, because everything keeps changing. So I make a motion to extend the temporary per diem clerk contracts for COVID vaccine clinics through 4/30/22 for Marge Achilles, Dina Zeibel, and Ingrid Mans.
I second the motion and vote aye, Saka.
And I vote aye, Medina.
And Malinowski, aye. Thank you. Okay. Okay, so the potential municipal COVID-19 antigen testing procurement. Heather, do you want to do this one?
Yep. So as you know, 100+ cities from the state had a distribution of antigen tests. Southborough was not one of the towns. This state has a procurement option for the other towns to order antigen testing. Again, antigen testing is a very moving fluid target. These are not in stock at many vendors. And our residents, I think, the focus for us would be on the employees, the residents, in terms of procuring through all the in-person, CVS's or the online are going to do better than what we can procure through the state offerings. I think some of these state procurements are at a minimum are going to take a week. Some of them I was looking at were 3 or 4 weeks away. So we're going to procure them for our employees. We need them for our employees to basically up and run the town cases. The healthcare providers, which for us is the EMTs, our state protocol to get a negative test, will do antigen testing on day 5 if they're going to work in that day 6 to 10 isolation period. So we need antigens to give to the fire department. So I'm working with them in terms of numbers to order. And I also have guidance on, clinically, sort of what's been approved tests and any other comments, but that's where I'm working to get the antigen tests. We have already we have antigen that we can run in the office here at Board of Health for our employees. But these would be ones that folks could take home. And with our day 5 for both quarantine before they return to work, if they're unvaccinated, and for our day 5 for return to work for the fire department, this is something that they need to take home. The ones we have in the office that we run are not the type that you can take home to do.
Thank you. Just for the public watching, Heather, I think one of the challenges, if we were to try to procure this for the general public, would be distribution, tracking of them, right? Because they're not reported to, they take them home, and what if they don't report it, right? So I think there's concern around that. And I just think, equitability of it, right? And, using town funds to procure something that we probably wouldn't have enough for all residents who are interested. So I think there's some logistical challenges with being able to make this available to town residents. So I just want, in case anybody's following, I just want them to understand why.
The logistics for the town residents would be, prioritizing. And at maximum, we would get them, one kit, 2 tests would be the very, very much maximum.
Right.
But also the state process, we're not getting particularly necessarily much better pricing, and we're certainly getting, I would say, less availability than what is kind of, if you commercially look on your own, both in person and online, you're actually going to get tests sooner.
Right. And also it sounds like that the federal government is looking to have
Yes, there'll
insurance
be that
companies
program, the federal
reimburse.
government, you sign up you get a kit. Yes.
Right.
And
So
that would
I
be
think,
anyone would be eligible. So yes, I think the procurement for our town via the state, as you said, would not be logistically favorable for our residents. And also I think they can have much more options time-wise to get their kits from retailers.
right. And I know that right now it's tough to get kits, and people are searching at, all the different CVS's and Walgreens. So I understand that it is challenging still on that side. I just don't think that we have the resources within town to be able to
all of them
to
and
do
I
an
don't-
equitable program.
Right. And I don't feel comfortable doing some folks. Yeah.
Okay. Safter and Nancy, anything else to add, or does that make sense?
Yeah,
Absolutely. Absolutely.
Okay. Okay. Thank you, Heather, for looking into that, and to Lieutenant Espasi, working with you on the SEMA side. Thank you. I had housing and food, but I don't think that we have any updates unless you have something, Heather.
No, not really. The Red Roof Inn, we had been there before with some structural issues on the breezeways and walkways. And I just want to state that fire and building were out there this morning, and the owner at our local Red Roof, they are really cooperating and working on all the citations there, and they're working on electrical as well. But the Red Roof Inn is really progressing in a great direction, and hopefully that'll be closed soon, because those housing ones can be tricky and last a while, but that's going well.
Great. Thank you.
The only
That's Heather.
update I was asking about was the front fridge, if we have any more updates on our front fridge.
So that I did not reach out to Pilgrim Church yet. So I was hoping to do that for the 18th.
Right, that, and
Perfect.
Diane doesn't have her guidelines for us to adopt for community fridge. Yeah, it's busy times.
So
It is
that's
a-
on my, that is on my list.
And it's sort of like a balance because I think we're going to see more food insecurity
Yeah.
as we move through, because I think even, whether we have shortened isolation or not, people, per diem employees, things like that are going to lose pay. They're not covered. People may have to miss work if their kids are still out of school. Like there's going to be a lot of challenges for a lot of folks, in the coming months, or even businesses shutting down without staffing.
Right,
So
right.
I'm
And
really
there is,
worried about that food insecurity. So that's great that
right.
we
And
can get it done and rolling as soon as possible. Yeah.
exactly. And also the Youth and Family Service, has some guidance for the food insecurity as well, that we're working with.
Okay, thank you. Next is the number 9, job description revisions and required information from personnel board. So I am going to go ahead and share my screen. And this is a draft of the nurse assistant health director outreach coordinator. And Taylor spent a lot of time with me, as has Heather, on their roles and responsibilities. So I went ahead and put this draft together based on, I think, what's a good reflection of what Taylor is currently working on, and hopefully, will be able to work on in the near future. But did everyone have a chance to kind of review this? And does anybody have any updates that they'd like to make to it? Additions, reword, anything? I'm not going to be offended.
I just see another HIPAA right there on the bottom
you
of
did.
that first page.
Thank you.
Yep.
Thanks.
I can do why don't I do a Control H and make sure I didn't have any more? No. Okay.
I was gonna say, I think it was just the 2.
Okay.
Perfect.
Thank you.
I didn't get a chance to think about it much yesterday because I just had a ton of people to try and call.
Of course. Yeah.
But I think, from our conversation yesterday, I don't think there's anything else to add, but if anybody else looks over it now and thinks of something, please let us know. That would be great.
And one note, Nancy, you had brought up in the requirements last week on the 10 years. So we brought it down to 5.
Okay.
Didn't want to go less than 5.
No, that's fine. Yep.
Okay.
I just thought 10 seemed like it would exclude.
Yeah,
Yeah.
I agree.
I do agree. When I applied for the job, the listing was 7 years.
Okay.
Because I don't have 10 years of experience yet. I'm almost there.
Well, you're getting it.
Yeah. And I did put this in the format that they just did the IT specialist in. So I tried to kind of follow their structure and plug in where I thought was relevant. I think some of the assistant health director roles are in here, coordinating clinics rather than, being the administrator in, some of the more leadership, activities that we thought were above, a nurse, or not above a nurse, but in addition to a nurse position. And, I think having COVID-19 and working in coordination with the town is going to be extremely important, as we just discussed with, testing employees and making sure that, we're following what we should be within the town. And then on the outreach coordinator side, it's, the social media aspect, communicating with any social network, the myselfborough.com, Southborough Access Media, kind of making sure that people understand what we do, creating educational materials for outside community members, other towns, So that kind of stuff. So I tried to bring in working with the greater boroughs in collaboration with the relationships that we've built there. Working with in town. Go ahead.
One thing that I was thinking of that I don't think is on there is work like developing relationships with, I think we talked about this, but maybe we didn't, developing relationships with like daycare centers and see if they have like a group of leaders that meet and things like that. I don't know exactly how we would phrase that, but
So you know what, that's in the report that we're going to talk about next, but I didn't put it in
okay,
here.
perfect.
You're right.
No, that's okay. Yeah, like business, even just businesses in general too around town, for outreach. Perfect.
So I mean, I would like to vote on this morning, in preparation for submitting it to the personnel board for their packet, which will go out on Friday. And I want them to have enough time to review it prior to their meeting so that if they do have any recommendations next Wednesday, that we can work through those pretty quickly. Now, if something were to pop into your head and we have that Monday morning meeting, I think it would be probably okay to make some minor, modifications if needed. But I don't want to rush a vote if you're not comfortable with this.
No, I think it looks great.
Okay.
I think
Zachary, you're on mute.
yeah, it's very comprehensive. Taylor, your thoughts. I mean, do you think that it's?
Oh yeah, no, I'm very happy with it. I think Chelsea did a great job. She did most of the work, honestly. So thank you.
Okay, so we made two revisions. My HIPAA, I don't know why I can't spell HIPAA, but that update and what?
Are you thinking of hippo, like a hippopotamus?
That's what I should be thinking. Yeah, that's what
Right, it should be.
yeah. So we made one revision. So with that revision, I moved to accept the proposed nurse, assistant health director, outreach coordinator for the health department, and to pursue presenting to the personnel board.
I second the motion and vote aye.
And I vote aye.
And Malinowski is aye. Okay, so now I'll go ahead and send this over to Mr. Rubenstein, who's the chair of personnel board, to put it in their packet. He did explain to me that when they meet next week, if they do have more than minor changes, then they do have another meeting scheduled in the month of January that we can address then. Or if they're minor, then they'll go ahead and continue with the process as we kind of work through any minor changes. So it definitely, he was very willing to work with us on that. That meeting is at 9:00 next Wednesday morning, and I will try to find out this week where we are on the agenda for that one.
I unfortunately, they had to put me on that day because they were dangerously low staffed.
Okay.
So I feel terrible, but I'm not going to be able to make it.
Okay.
We're just having a lot of people quitting.
Yeah. That's awful. Okay. That's okay, Nancy. And I'm going to post anyway. So if something changes,
Okay. All right.
that's fine. So I need to jointly post for that. Okay. Okay. Thank you. And then for the health director position, Heather's put a lot of work into updating that one. So my goal is to put it in the same format that I just put that one in.
Oh,
And then I need to, I have one more session to do with Heather that will hopefully round out the same process that I did with Taylor and then complete the report that we're going to talk about next. So I still have some more work to do, but that's less pressing because it's not going to personnel board. That's just for us to make sure that it's accurate. Okay. All right, number 10. So this is the annual report draft, and this is really for people who want to get into the weeds on what the health department is doing, should be doing soon. And soon, I mean like within the next year, and kind of future wish lists, I guess is a good word, right, Heather? So Heather Taylor and I have spent a lot of time going through what all the tasks are, I guess. And then Heather's done a great job of kind of looking at some future ideas. So I think I pretty much have most of it captured in this report. And what I would like to do is, I'm not going to go through this one by one, but if there's a topic that you all want to discuss and add to or clarify, then I'd like to do that here. And I'd like to finalize this report for advisories, for our meeting with advisory the end of January at our January 18th meeting. So we have 2 more weeks to kind of get this to prime time so that we can then go and explain to them, you know, what we're looking to accomplish with the funding proposal. So, and I have some more work to do on some responsibility sections, and I think I have a few more categories that I need to add to that I just didn't get to yet. So you'll see some blanks as we go through. But I guess we'll start with communicable disease control.
So I have a comment on that. I mean, should we say
Yeah,
like,
go ahead.
when I think of policy development, I think of the nurse and director collaborating on that for policy development. When you have their project develop policies and procedures for types of foodborne illness, I see that as a collaborative thing for both roles. Up at the top.
Yeah.
The foodborne illness.
So,
Yeah.
Taylor or Heather, do you want to?
What do you think about that?
Well, yes, I would clearly review and or
Right.
with Taylor when she's developing.
Yeah. So what I think our plan was is that I would kind of get a policy together and then
Got it. Okay.
Heather would review it and help me make changes as needed and then go from there.
So should we put both in because as a because I guess the development part would still be that it would be more the review later on. I get it. Okay. Okay.
And then the next one, staff stars for Heather and Diane
Got it.
on the education of the
Right.
restaurants and that kind of
Okay.
piece. And then there's disease track, and so what I tried to do was outline projects, and the projects mean that like we haven't done it yet.
Right.
And then the ongoing maintenance is what we are doing and are continuing to do. So that's kind of how I tried to lay it out. And I'm, if you have a better way that you think that we should be communicating this information, please feel free to tell me. I was trying to make it clear. I know it's long, but I felt like this is what they're looking for in terms of the roles. So disease report tracking and reporting. And this is where I said I kind of changed how I was doing it midstream. So this, I would put the responsibility for project and ongoing maintenance under nurse, and anything in yellow is something that that I'm missing. So I just need to get that information and put it in there. And for this yellow, insert timeline for those investigations here. That's going to be a sample of like COVID investigations or a tick-borne illness investigation. So that way we can kind of paint a picture that it's not consistent. And this, but here are some examples of how long an investigation takes.
So you can put, I was kind of thinking about this, and Heather,
Yeah.
you could please weigh in too. I think for COVID, like you could put an hour. I mean, the thing is like sometimes if a patient's really sick, you're continuing to follow up with them for over a week. But I
Yeah.
think in general, when we speak to patients, like after we do all the contact tracing necessary, it's about an hour for our cases that are in school, which is most of our cases right now.
Okay. Okay. I will
Uh,
add that. I'm just taking notes.
Yeah, and then for our tick-borne cases, it's, you know, it's hard because it's more like tracking down the information. So it takes a few days, but once you have all the information that you need, it's like a half hour worth of work. So
Okay.
it's just getting the information is the challenging part of it.
Okay, but I think I can put that in there, saying that it takes a couple of days to gather all the information. So that way it's not just the half hour that once you
Yeah.
get it.
Yeah.
Okay.
And then mosquito-borne, I honestly don't know because we haven't had any since I've been here. So knock
Okay.
on wood, hopefully that stays that way.
All right.
But that I do know, like if we did have a case, there's like statements that have to be released to the town and things like that if we had an active case in town. So it's more than following up with the patient.
Okay.
And then like a TB case is like usually 4 months at least.
Okay. To track them.
Yeah.
Mhm.
Okay. All right. I can add those 4 examples, and I think it'll just give an just give a idea that it's kind of all over the place, but in
Mhm.
general, this is how these would follow. Okay.
Yep.
Should we put in more illnesses, or do you feel like that's enough representation? I guess Taylor and Heather, I mean, I sort of on the other side of clinically diagnosing a lot of illnesses. I know a lot of things get reported to the Board of Health, not just
Yeah.
these illnesses. So do you want to add more? I'm thinking, and I think you put communicate with the school population, but we get pertussis outbreaks every now and then. And,
Right.
and you track all sexually transmitted infections and things like that as well. So I guess I'll leave it up to you and how much to put in there, but I feel like the more we put in, the better as well.
Yeah, I think we could do like just list out all the diseases. I'm not sure. Like some of them are just like we track, and if we see a pattern, then we would maybe bring it up to the state level to do a joint investigation. But for the most part, it's like you're just acknowledging them.
Okay.
And kind of monitoring, make sure there's not huge outbreaks.
Okay.
So I'm not sure.
Okay.
What do other people think?
I mean, I don't think it would hurt to throw in
Right.
things like whooping cough and meningitis and those things that can,
Yeah. Flu,
Hepatitis.
hepatitis B and C we track.
Yeah.
I'm happy to add the list and just say these are the things that we look for patterns in
Yeah.
to then take it to a further investigation or something.
Sure, I can put a list together for you.
Okay. Thanks, Taylor.
measles, you got mumps, you got all that stuff.
Yeah.
I know.
Okay. And also something that Taylor, Heather, and I talked about was they know what to do because there's state guidelines around how to follow any sort of case. But that we don't have like internal policies and procedures within the department. So looking to put together policies and procedures for known types that we have. And as new things come up, then we would develop a policy and procedure. So that's the project piece there.
Mhm.
And I think we can rely on the state for that information. Go ahead, Taylor.
When do you need this piece by?
Like next Wednesday,
Okay.
is that fine?
Yeah.
Okay. Okay. And then vaccination clinics. So this is director and nurse. And Taylor, this is where I had established yearly clinics with daycares and preschools.
Oh, okay, great.
Yeah. So Taylor was kind of brainstorming on things that she would like to do in the future to kind of promote targeted audiences for clinics and also increase awareness of homebound. So Taylor and Heather were able to do every homebound that they were aware of, but maybe there's a larger population that are obviously more vulnerable that they would like to try to get on their list. And I think this one in particular is kind of a fluid situation. Like, we're adding clinics, seems like every
Right.
other day. So this is obviously a large portion of what they've been working on most recently. And then substance abuse prevention. So this one, Heather wants to take on in terms of a project by organizing Chapter 84 program. And then Dr. Medina, we took the liberty of adding your name into this one. And along with Metro West Tobacco Control to update Southborough's guidelines and that sort of thing. And then the Northborough Southborough Substance Abuse Coalition. So that's working with Bright Solutions Consulting. And this is in collaboration with Northborough, obviously. So that would be both Taylor and Heather.
Right, it's substance abuse prevention.
Thank you. I guess it's good. I told you I wasn't going to go through all of them, but now I started to, so I guess it's good that I did. Wait, substance abuse prevention?
Coalition.
Okay.
Yeah.
Thank you. Thank you. Okay, and then records retention. So I put the Taylor and Heather, I got this one, I categorized all of them, and then I had this one left over, so I put it here.
That's fine.
Okay, so this is back to all of those types of records and how long we have to keep them for, which ones need to be permanent. So this is actually a pretty large project, and I'm hoping that as part of the ARPA bill that was signed at the state level, that there'll be an opportunity for us to apply for some software to be able to digitize records. So this would be Taylor and Barbara kind of spearheading this and, reviewing what we currently have and then developing some sort of tracking mechanism for these types of things to make sure we're within compliance. Okay, and then chronic disease and injury prevention. And so Heather had come up with 2 future projects for this. And Heather, go ahead, feel free to jump in and talk about the study that you did in May. I'm not sure that SAFTAR is aware of this. Maybe it's
Right. So I had an MPH intern in the spring. So in May, we put together a needs assessment with our residents where we found kind of available data sources. The data is out of date. With COVID, folks aren't always able to, but Metro West Health Foundation keeps a good database for the communities in Metro West on health topics. So some of these health topics that I put there, our Southborough residents had sort of higher than sort of the average of our Metro West communities in those areas. So at this point, we're not getting to this, but would love to get to this. At that point, I would relook at the data and target our chronic disease where we can work on some prevention campaigns.
and then the Walk with a Doc program.
Yeah.
That's
So
another-
that's a program that I know about through Worcester. So that would be, if I or someone else, just makes a sort of twice a month or, weekly plan to do, a 30-minute walk, open to any resident, just as time to see the Board of Health and to promote exercise in our community.
Right.
So the only thing, Heather, I'm thinking about adding to this, and this is something, again, we can look more as a future project is, and and I don't know where our rates in our town of mental health illnesses are compared to. but
Yeah, I was
imagine
thinking
it's
about that
very
too. Our
high.
residents are
Yeah.
interested in mental health. That
Mhm.
was on our community survey as well.
Mhm.
So mental health. I mean, I was thinking about that. Exercise is prevention for depression
Right.
and anxiety. So that's why I also like that walking one. But yes, did you have other ideas? I agree with the mental health.
Yeah, and I think that's more of a collaborative thing with youth and family services, obviously, and things like that. But I think maybe that's more not a specific project, but a future goal or a
Absolutely,
vision to have
absolutely.
Board of Health
Right,
takes a more active role in mental health as well.
absolutely, right. I mean, right. I don't know if you want to.
I
So
don't
I
know.
wrote that down.
I don't know how to word that in there,
To
but
add that, right, right. Future project, further collaboration with youth and family service on mental health topics.
Yeah. Okay.
Experienced by our residents. Chelsea, I did put it in that document to you.
Yeah,
I did.
I'm wondering if I have it
When
below.
I first sent that document on Christmas, it was in there,
Yeah.
mental health, and I had some ideas.
Okay.
One
I'll
about
go back to it then. I missed that one.
linkage with clinical care, because I thought if we get
Yeah.
data, we can get certain data, and then the other data would be speaking to the primary care providers in the area, and what are they seeing with mental health, and what could we do help to educate and prevention. Yeah, that was in my original document.
It was. So I have the linkage with clinical care. I just didn't finish. So do you think that the collaboration with youth and family services should be under chronic disease, or put it on the clinical piece?
I mean, at this point, I guess just put a mental health can be a
Category?
freestanding topic because it's that important.
Okay. Okay.
It was
I'll
on
add
our
that then.
community survey. It was in the top 3 for our community survey.
Okay. And then the environmental public health. So this includes trash haulers. So we know we need to develop rules and regs for trash haulers. The water quality of wells is Heather. And that's a future project on developing an educational program on water quality in wells. Noise, I think Heather's taken the first, a good first step in terms of joining the ad hoc noise committee to come up with a town bylaw. But obviously there's a lot more that the health department's responsible for outside of that in terms of noise. So that's in there. And I think I probably need to expand on that in terms of explanation.
Can I be added to the trash haulers? I'm the one that's dealing with them all the time.
Yeah, because you're ongoing maintenance. Thank you.
Mhm. Now, quick question. Am I
Yeah.
an administrative assistant here or business admin? Where I do payroll and everything. I'm confused. Sometimes it's a business admin, and when I get up to the other place, I know it's admin assistant.
I don't know.
I don't need,
I'll try to find out. I don't know.
like,
Good question.
I think it's business, but I
do
right.
payables, payroll. I mean,
Yeah.
Okay. I will find out and update it, Barbara, on here.
okay.
Yeah, I think it's business admin. I don't know kind of how the official listing, I mean, how Barbara's role is official. For the requirement, she meets it, in my opinion, but I don't know how she's listed in the employment.
Okay. I'll find out and update this before I resend it out. Okay, so noise. So disposal of special waste. So this is expanding on the current needle disposal program that we have. In particular, we have a small box at the DPW that you would need a transfer station sticker in order to access. And so this is something that Heather and Taylor would be able to hopefully expand on and maybe even make it to more than just needle disposal.
Yeah, and we need this soon for us.
Yeah.
Yes, I have
True.
over 9 medium-sized boxes filled with needles sitting in my office.
Okay, septic review. So this, and this report does not, this report is kind of, does not address the actual, a lot of the inspectional services that the town provides, but this is more of Heather's involvement related to plan reviews and signing off with like Concom and planning and building, maybe, Heather?
You know, the planning, when folks are up in front of planning. But yes,
Okay.
I mean, Dennis reviews for the building department.
Okay,
I do
okay, so
too.
this is,
Yeah,
I
Barbara
do-
and Barbara
for
does?
the building. Yep.
Do building permits too. I
Okay,
get into the hard ones.
And we
okay,
give Dennis the hard ones, right? But I'm the one who submits back to planning. I mean, in terms of in consultation with Dennis, but
right, okay.
I think
So-
just one other thing that we could add,
Yeah.
and it probably wouldn't be up to me, it would be more Heather, but maybe like a project where we could do like education on septic safety with the public.
Okay,
yeah.
what do you think about that, Heather?
To at least kind of know some of the, you know, procedures and protocols, you know, we recommend
Yeah,
you
like
know, that you have your septic
like
and kind of
pumps
some of the
and
requirements,
Yeah.
requirements for buying and selling. I don't think people know
Yeah,
about that. So
things to not
education,
put down the drain,
Yeah.
like those types of things.
Okay,
right? So education, but also making them aware of some of the procedures and regulations when they are,
Mhm.
you know, not to find out last minute when you're trying to
Buy or
Okay.
sell.
correct. So if you could,
okay. Okay,
It could be like even something that we just like maybe do once and then put online so people can.
right,
refer to it.
exactly, a written document that we put on our website.
good idea. All right, I'll add that. Okay, air pollution, this one I need to add to, because if you remember, Heather applied for a grant that we're
Right, we haven't
awaiting on this
heard,
one.
we haven't heard, but with COVID, everything's backed up, but I am still working on this and I'm working on a presentation to the library. You
Oh,
know, it's a
right.
presentation this winter
Right,
on this topic.
Okay.
Mhm.
you'd said that, okay. Okay, so I need to add to that, okay. All right, I know you had something in there related, somebody had something somewhere to maternal, child and family health, so I left it in there so that I would know I needed to add to that as well.
Yeah, I think it was a short thing from my original document. Mhm.
Okay. And then I think I added this category because I felt like it was important to keep the communication lines open with all of these different groups. I'm not going to go through everyone because I think they're pretty self-explanatory, but I think that this is a large part of what Heather and Taylor are doing and have been able to expand on. And I also think that I probably should add Barbara to a lot of these because she's the intake person here. Probably not the outside agency one, Barbara, unless you're communicating with like DEP and OSHA.
Mm-mm. No.
Okay. And then like proactive outreach with like Facebook, and you may be
Certainly
actu-
nurse is the lead, but I definitely do some as
Yeah.
well. I posted on
Okay.
Facebook this morning.
And I think if we end up with something like constant contact, then Barbara would probably be on that too. Did you say business assistant is what you think? Not business admin.
Business
Administrative.
admin. Right?
Oh, okay. I see. You're doing it based on the role.
Is that right, Barbara? Business admin.
Mhm.
Business admin. Okay. All right. I'm gonna have to go back to it because okay. And then working with the senior center, you know, there's some that happens now, but I think they have some really, the staff have, Heather and Taylor have some really good ideas on how to leverage Diane and work with the other towns as well. So I think there's a lot of good things that can come out of that one. And then obviously emergency preparedness, which they're already doing. But that there's some, there's more project-based stuff that can be done in addition to the ongoing maintenance. And then I need to add to the clinical care. So I have some things to add for disease tracking, a mental health section, expand on noise, add a project under septic for education, air pollution I need to add, and clinical care I need to add. And then anything else that comes out
Is
of
is it somewhere reflected, like you had said under Taylor's contract, working, with the 4 towns, having a relationship in the boroughs?
Oh,
or-
that's a good idea. Yeah. Thank you. Good add. And this is more heavy on the public health side and not the inspectional side. Because I think this was more of the gray areas than the
That
inspectional
people
side.
don't know about.
Right. So I did not go through and go through the inspectional side, but if advisory asks us to, then I can. I just
Right.
I'm running out of bandwidth.
Yeah. But from the public health side, for me, I mean, I still am, I'm kind of consulting and reviewing the inspectional, the food and the housing and the
Right.
septic are run by me. Yeah.
Right. Yeah. So actually, we should probably add something on housing and food. Okay. So Safter and Nancy, I know I just went through that pretty quickly. And thank you for kind of adding along the way. Do you think that there's any sections that are missing?
Nothing that comes to mind, quite honestly.
Okay.
Do you want to put something in there about our involvement with like public health programs like MHOA and things like that, or MAPHN?
Yeah.
Or
Yeah.
and
I
what's
think
the other one that you're part of, Heather?
I do the NEHA and the
NEHA,
NEHA.
okay.
and then NACHO.
NACHO, yep, I do that.
How do you spell, what's the acronym for NACHO?
I think it's NACCHO. It's National Association
Okay.
of County and City Health Officials.
Okay. Yeah, I should add that too. Go ahead, Safter.
I didn't see specifically, although it's alluded to in some of those things, is the actual role with the school district, because basically they are our public health consultants.
Yeah.
Any medical decision that the school district makes is made in consultation with.
Yeah, we could also include the medical advisory team piece of it.
And when that, when the COVID part of that goes away, that's still going to be in place for any public health issue that comes up. So
Okay.
True.
You could also
So-
put that on my
Job description.
description, the MAT.
Job
piece.
description.
Okay. So you're okay with me just adding that without taking another vote, right?
Yeah.
Okay.
Well, I guess it's not up to me.
it would definitely be, because any given Tuesday I meet with Heather and Taylor at least 2 or 3 times. So,
Yes.
so
Busy day.
And sometimes Sunday night as well.
Yeah.
on the weekends, exactly.
Yeah. Okay. So, so what I'll do is I'll try to get this updated. Not tonight. Maybe tomorrow night, and get this out to you so you have enough time to, Safter, if on the school district relationship, if you want to like completely reword what I do, like go ahead and do, like I'm totally fine with that. And then bring it to the 18th, and then hopefully we'll have a pretty good list to bring to advisory.
Thank you, Chelsea. This is a lot of
Yeah,
work.
thank you. We
You're
appreciate it.
welcome.
Thank you.
Thank you.
You're welcome.
Thank you.
You're welcome. And are you, I know I kind of just went with the format, but and Heather, Taylor and I kind of reconvened yesterday, and I reorganized based on category because the way I started it didn't work. But if you have any other ideas on a better presentation for it, feel free to let me know. Okay, you good on that?
Mhm.
Okay. All right, so Metro West Health
Right,
Foundation grant.
Grant, right. So
Yes.
there's an open call through Metro West Health Foundation. I think it's like 26 towns that they cover. So for any other towns to apply, application due January 14th, and the money would come early February. This is like meeting immediate need, I mean, in February for COVID help. COVID, and it really related to COVID. It could be a lot of things. I double checked with them. So
Okay.
it could be contact tracing. It could be things for a vaccine clinic or outreach and education for the community. So in Southborough specific, I was thinking about our per diem nurse who's amazing, and Chelsea would know better. I don't know that we have a lot of big per diem budget here in town, and with questionable FEMA.
Yeah.
Yeah, so for contact tracing and her work at vaccine clinic. And then we do need more iPads or technology for clinics. We have something else out for that as well, but that would be covered. I asked them.
Okay.
And then
Oh,
say-
that's awesome.
Yeah, I asked them. And then I said, hey, if we have clinics, like the Salmon VNA would be covered. So, costs related to clinic and contact tracing, basically. So a town can apply up to $50,000 and the money would come in the spring. We do have the contact tracing grant. So we are slated to get more help through our boroughs, through contact tracing. And the Metro West, I haven't spoken much with the boroughs about it. The town of Southborough would either apply as the town of Southborough or as a regional, with the different towns. I'm seeing some of these things that I just mentioned as sort of Southborough specific. So that would be my leaning, but I cannot apply as both. So I don't know. I'll have to talk with the boroughs about that. But in terms of our per diem, our technology needs is not the borough's needs. That's what I think.
So, and it's 50,000 if we were to apply individually, and it would be as a max, right? And if we were to go in on another town, it would be 100.
As a boroughs, I think it's, I think
It'd
you
be
could,
50 per town,
exactly 50 per town.
right? So there's really no, it's not like you're
similar.
going to get more money from a region.
No, and I guess I have to talk to boroughs. Would it be clear that we
Yeah.
would get that 50,000 that would come kind of directly to us versus something that would be applied to more of the region than, our particular
Right.
per diem nurse and iTech needs.
So, and did you get a sense if you applied for a region, if you had a better chance of getting it or not?
That I didn't have a sense.
Okay.
But that's a good question. I can run it by them about Metro
Okay.
West. Mhm.
I mean, I think if you can talk to the boroughs, Heather, and then, figure out if anybody else is, if everybody wants to apply on their own, I think that's fine. If there's any compelling reason to apply as a region, I think either way is fine.
Right. And yep.
Okay.
I mean, it is
Do you-
helpful. Like I said, it's for this current kind of
Yeah.
surge here and meeting that testing. That was the other thing, testing. Mhm. COVID
Okay.
testing, COVID vaccines, and COVID contact tracing.
Okay. So do you need us to vote to apply for this?
Right, application is due
The
January
14th.
14th, and like I said, I don't really have developed exactly which way we'd apply, but I suppose we can vote to
pursue it.
approve an
Okay.
application, but I'll certainly let you guys know further when I have that developed further.
Okay. And let me know if you need help filling that out. I'm happy to do any, administrative stuff on that. So I move to authorize Dr. Alker to apply for the Metro West Health Foundation grant.
I second the motion and vote aye.
And I vote aye.
And Malinowski's aye. And then Heather, whichever way it goes, if it's local or region, I think just let us know. Thank you. Okay, number 12, case numbers, and vaccine clinics. I didn't know if you were going, I just kept it on there in case you wanted to say anything.
Yeah, I can say something to both. So,
Okay,
so just in terms of vaccine clinics, on Wednesday, tomorrow night, we have our second dose clinic for our 5 to 11-year-olds. This is the second clinic that we're hosting. And then on Friday, we have another booster clinic scheduled, and 12 to 15-year-olds just got approved for boosters, or 12 to 12 to
Yeah, 12 to 15.
12 to 15-year-olds just got
Yeah.
approved for boosters. So we're in the works on planning 2 clinic nights at either in Northborough, Southborough school system. Those dates have not been officially decided on yet, but they'll be in the next few weeks. We have to make sure that we have the bandwidth with vaccinators before we announce anything. But I think that something is going to be put out for volunteers today or tomorrow.
Okay.
And there were a few spots when I checked this morning for Friday, January 7th in Northborough in the morning, and I put the
Pushed
link on
out again.
Facebook.
Yeah,
January
and I had
7th,
previously
Friday
put
morning.
it out. The platform that we use right now, Color, does not have, it has not fixed the program yet to allow 12 to 15-year-olds to sign up. Usually it's like a few days behind. So I anticipate that that will be fixed hopefully before Friday, so we could fill our slots, but maybe not. Hard to say.
to get anybody in on Friday for a booster, you mean?
Right. I don't think it's
Oh,
good, but
okay.
for 12 to 15-year-olds.
Got it.
And they would have to miss school also. So we also have been having a few inquiries about first dose, which we're continuing to do and accommodate for people who are looking for first dose in the vaccine series. As far as like vaccination rates go in town, they continue to be high. 93% of our population is fully vaccinated. That's overall in town, our population. So that's great. I think we are seeing more people who were hesitant before now with this surge kind of being like, okay, I want to get this vaccine to protect myself, which is good. And then just shifting to COVID cases, everybody knows that COVID cases are high, but just to put it into perspective, in the last 5 days, we've had 108 cases in Southborough. That's cases that have been reported to us. So there's also, based on what the school has for numbers, there's just as many cases that haven't been reported to us that are at-home tests. So really, we're looking at probably almost double what's been reported in town for COVID positive patients. Everyone knows, but just to make it aware, it's really hard to find PCR testing, unfortunately, right now. Ashland MBTA station, which is one of their free sites, just moved to appointment only because of their capacity issues. And same, Framingham site continues to be appointment only. And the New England Sports Center site, which is Marlborough Hospital's affiliated site, is overwhelmed as well. People getting there at 5 a.m., waiting in line, maybe get turned away by 9, still haven't gotten a test. So, and doctors' offices are not having people come in unless they're symptomatic to be tested. So definitely really challenging to find PCR testing right now, which, I just wanted to acknowledge. And unfortunately, there's not really a solution. The state is aware of the problem, but I don't know how they will fix the problem.
Taylor, are you getting people calling in to self-report if they test positive at home?
Not really. I've had maybe 2 people. That's it.
1 or 2.
So
Yep, for me.
should we be like just putting something on our Facebook page to just ask people to do that?
The challenge of that is that I'm going to be honest, I can barely call all the cases that we have as
Right.
it is.
Right.
Yeah. Okay.
I don't have a problem doing that, but I can't log them anywhere.
Okay,
We can just guide them on their isolation and
So I can put something
Quarantine.
out saying that if you
That's
tested
fair.
positive at a home test and you have questions about isolation, to contact us. But I think people are also calling their doctor's offices and the questions are getting answered through their doctor. So I'm
Okay.
not ultimately super concerned about it, but I could certainly put that out just to say, if you have questions about isolation, feel free to call us.
I mean, it sounds like people are calling you with questions now.
Yeah, for sure.
So I think you probably don't need to. I just didn't know if there was a gap where people are supposed to be reporting it to you and they're not, but
So-
it
They're advised to on the box.
yeah.
I think people kind of know what to do. And I think the people who aren't sure what to do call their providers. Like I said, I don't really have a preference either way to whether we put it out there or not. The thing is that if someone does call us, the state advises us to tell them to get a documented test, and then people get really frustrated when we tell them that because there's no available.
Okay. Right. Okay. I wouldn't do it then.
Yeah.
Okay.
Yeah, because they've already paid money to do this test. And I think by and large, people are so aware that when they get a home positive test, they are going to do what they need to do based on it. And then ask
Yeah.
questions if they need to. So.
Thanks, Taylor.
Yeah.
Okay, so let's make sure I write this down right this time. So the 18th, what time are we doing?
Well, do you
10?
want us with the 10th, 9:30, right?
All right, yep,
Yeah,
thank you. 10th,
9:30, we discuss the mask mandate, right?
yes, that's a pencil in, okay. And then so then we have the 12th, which is personnel, right?
Yeah.
That's at 9, but I'll ask what time we're on the agenda or where we're at on the agenda, not necessarily a specific time. Okay, and then the 18th. 10?
A little
I'm free
later,
all that.
10:15 or 10:30. I just have a meeting
Okay.
that
You
ends
got
at 10:15. So,
So let's do 10:30. And then,
Ugh, I'm freezing.
we're almost
Sorry,
done.
guys.
Okay, and then we can shoot for the morning, then on the February 8th and then March 8th. We don't have to set that now, but. Okay. All right.
and do you need, I will not be able to make the select board meeting tonight, but I think it's pretty set.
Okay.
I don't think there's much to
Yeah.
discuss about town meeting. I think we're all pretty set with it, right?
Yes, I didn't want to preclude you from not being able to join. That was all. So I totally understand that it may not be convenient time. But Nancy, if you're there,
I
I'll-
am here now. I don't know what's going on with my tablet. Sorry.
no, that's okay.
You guys keep freezing. I don't know if it's
Oh.
probably me.
Nancy, if you can join tonight, great. If not, it's totally fine. I just didn't
Turn
want
you
to.
out. And then I didn't hear, what was the time definitively on the 18th?
10:30.
10:30. Okay.
Okay. So sorry about today. I obviously messed that up. Okay. And then we still need to get on advisory. So I will reach out to them this week now that I know where we're at with the report. I wanted to make sure that we were kind of headed in the right direction. So that's great. Okay. Anybody have anything else before I go to public comment?
I don't think so.
Nope.
Nope.
So any public comment, feel free to raise your hand. Okay. All right. So I am going to move that the Board of Health adjourn at 1:24 p.m.
I second the motion and vote aye. Nancy Sacco.
And I vote aye as well.
Okay, and Malinowski's aye. Thank you very much, everyone. Have a great rest of the day.
Are you going
Bye.
to, Chelsea, are you going to come up with like the one item agenda for Monday, just in case we need it?
Yes,
Okay.
yes. Yeah, that's
All right.
fine. I'll do that. Thank you.